have a brief comment from Chrisman from the Summit team, making a plug for an opportunity there. Then we'll go to Dallas Clements from RaiseBerry, and then we'll finish off from Jared Jeffrey from healthKERI. And so 7 minutes of presenting, 5 minutes of Q&A. So if you're hearing or if you've got questions along the way, just put them in the chat, and then you can either come off mute in the Q&A or we can just read them out, and we'll go like that. So let's turn it over to Brian Coy. And then Hannah, let's use that timer, and so Brian knows that he's against the clock. Yes. The full screen share.
Now I've lost it. So here we go. All right. Okay. And it's 7 minutes, right? Is that what you said?
It's now 6.5.
Okay, perfect. That's all I need. All right. So MedCart AR. If you're not familiar with hospitals, there are things called code blues. Code blues are when someone is experiencing cardiac arrest or respiratory failure, and they're needing immediate life-saving measures. And so in the United States alone, only accounting for hospitals, that for an adult patient, that's happening every 2 minutes, and every 90 minutes for a pediatric patient. And the Joint Commission is this organization that accredits hospitals. And in these hospitals, they did this study, and they published an article about it. And they found that staff are unable to locate these life-saving carts, and they're unfamiliar with what's in these carts. And even if they think they know where that something is in the cart, they're not able to locate it. So overall, just from top to bottom, there's a lot of inefficiencies, and they're ultimately, these nurses are unfamiliar with these crash cart procedures, which is if they're happening every 2 minutes or every 90 minutes for these types of patients, that's pretty alarming. We don't know where these emergencies are going to take place, but we know they happen very frequently. So we always have to be prepared. So the solution, that's the genesis for this company, is we are going to recreate replicas of what these hospital staff are going to use in real life and put it in nurses' pockets. And we do that through our app. So they're going to be able to interact with it as if, and it will look just like what they would have in real life. So there's 3 different views of the app. We have quick search, which is like a directory. We also have Explore an AR, which is really great to help them orient themselves with the material in the cart. And then we have time challenges, which is where the rubber really meets the road on the learning process. It keeps track of accuracy, the time it takes to find a certain item, and then all that's reported back to the management to help them make in-person training far more effective. And the end result is these nurses are confident and they don't have these skill gaps. So I want to show you a very quick video of what this looks like. And I'm not a surgeon, so I apologize if you get seasick. The first half of this video is going to be that walk around, that explore feature, where you can just orient yourself with the cart. And the second half of the video is the timed challenge part, where in simulation, at least in healthcare, we call it gamification, where the learning or the education is gamified. So you'll see that in the second half of the video. So this is the scenario in that gamification experience. It's a drug addict's in the hospital for treatment and secretly using opioids. They go into cardiac arrest after ODing. You and the team respond, tackling both complications. Find what you need to from the cart. And right here is you place the cart, ready, set, go. So you'll keep an eye in the top right corner, there's a timer. There we go. So the benefit of having this tool in your pocket is it's a facility cart specific to your institution. It's in augmented reality. There's no headset required. And by having it on demand, there's no skill gap. So the nurses just have a lot higher confidence going into these emergencies. The feedback is very positive from our users. These are actual customers that we work with. Yukon is a recent addition, and Maimonitis out of New York. They just like how realistic they are, that it's able to be used from anywhere. And a little bit about me, I'm Brian. I've launched over 20 products and managed a portfolio of over $500 million in revenue. And Kyle is the developer. He's launched over 11 apps. I'm sure there's a revenue in there. I just forgot what it was, so there's an X. And since inception of 2021, there's been over 500,000 invested. This technology was licensed by Summit Venture Studio late 2023, and I was brought in as a co-founder early 2024. We're nearing 80,000 in revenue and have just over 1 million in pipeline now. So we're projected to far exceed our goal of 160,000 for next year. The market opportunity, it's not just hospitals, there's actually pet hospitals. If that was a new one that we're experiencing. We're partnering with manufacturing cart companies, education places, simulation, and of course, hospitals. And there's a lot of, and though that previous slide is very similar to what this is. And thank you for listening. I'm happy to answer any questions.
Under time. Good job. Okay. 5 minutes of Q&A. Let's see. I know I put a couple in.
Let's see, I'll pull them some up.
Yeah, let's see.
Dr. Suzanne Richens, you've
Cool. Some product endorsement here. So I'm curious, Brian, your team slide.
yeah.
Where do you have gaps?
I'm needing more coding people to help me improve the analytics. We have we have a very good roll up of analytics, but as far as as far as getting granular data, we're not there yet. There's improvements that can be made to make management jobs more more simple, so they can just report on these are the metrics, these are the results, and this is why we need to keep using MedCart AR because it's working. And that's probably the big thing, is developing that part of my business.
Okay.
One of the places that could really use it, and I wrote it, is ambulatory centers. Fortunately, in the hospital, there's a code team, and so they run to a code. The value is still that there are other people on the code that may need to grab something, and it would be valuable. But some of these ambulatory centers have infrequent codes, yet they're required by the state for licensure to be prepared to handle a code. So if you could get into that market, because there's so many ambulatory centers where they do surgeries, where they do in kind of minor invasive things, it would be a really good idea to connect with them.
I didn't even think about ambulatory centers, to be honest, so thank you for that.
Yeah, if you want to talk at a later date, I could help you with that.
I would love that, yeah. So where are you an educator now?
Oh, several universities, mostly Morehouse School of Medicine and Post University.
Cool. Well, thank you very much, everybody. Did I miss any questions in here?
Dave Dolan asked, is this tied to certification or licensure? Or could it be? Should it?
Yeah, Good question. It's not right now. It's something I'm exploring doing. So if I had a deficiency on the team, it would be exploring those type of things. Like how can we make this more appealing to what's already part of the hospital or nurses' annual requirements? That would be one of them. So that would be
They already have to certify annually, so I see it fitting into the recertification requirements because currently they do take like paper tests and they run simulations. But this would certainly improve their competency and the reaction time.
Yeah, absolutely. Yeah, I think what I meant by that is more just on the continuing education piece. It's not listed as a continuing education requirement.
It is internally, but not externally.
Right. And that's where I think maybe I could provide a little bit more value to give them some more opportunities to get credit. And this is just a fun way to do it.
Okay, I can tell you organizations to contact.
Oh, gosh, Susan, Suzanne, you're my best friend now.
That must be why Spencer invited me today.
Woo!
So Brian, and thanks, Suzanne, really. Brian, why don't you just go offline on some of the other questions that came in and just respond to them directly? That would be awesome, just in the chat, and we'll move on. Thanks, Brian. Little
Yeah.
clapping, woohoo, cheering for Brian. Good job. Okay, Chrisman, come off mute and do your plug.
Sure. Thanks, Spencer. So I'll just flash this here real quick, and I'd like to thank everyone for joining us today. We hope you'll enjoy today's presentations, and also please consider this as an open invitation to connect with Summit Venture Studio. As most of you may know, we're all about launching software startups and would love to collaborate with you as a co-founder, advisor, investor, or subject matter expert. If you or someone in your network is interested, please fill out this form, our Work With Us form. I'll be pasting the link in our chat box, and our team will be in touch to discuss potential opportunities. Also, please feel free to share it within your network, and we're excited to explore how we can work together to make things happen. Thank you.
Thanks, Crispin. All right, going now to Dallas.
All right, guys, let's see how quick I can do it now. Let me get in here. Second. Boom. All right, guys, we are RaiseBerry. So we're a fundraising platform for
Dallas, are you sharing your screen right now?
Oh shoot, let me make sure.
Just want to make sure.
Yeah, we need to do that for sure. Boom. Can you see me now? Oh, nope, got it here.
I can feel it. It feels like it's close.
It feels like we're making it happen right now. You know, one problem is this laptop is brand new. So I've got to let it know that it's okay. I'm fine with Zoom doing this.
How long before he realizes he's not here anymore? Well, he's let's shift gears. Jared, are you ready?
Yeah, totally. Happy
Okay,
to.
let's do it. Let's do it, Jared.
Well, let's do this. First of all, can you hear me? Second of all, can you see my screen?
Yep, good to go.
All right, let's run through this. So my name is Jared Jeffrey, healthKERI is the name of my company. It is a B2B SaaS for securing clinical data exchange. To start with, just a quick intro on me, the team. I am 12 years in healthcare IT, most notably as the head of marketing for Class Research. Class is basically Gartner mixed with consumer reports specific to healthcare IT in the US. So if you're familiar with people like Intermountain or others, they don't make buying decisions to the tune of millions of dollars unless they are looking at Class data. So I spent 5 years there, got a very high level view of the industry. About 2 years ago, I was diagnosed with brain cancer, which was just a party. But I did I think the very normal thing, which is you get diagnosed with a life-threatening disease and then you start a company. I feel like everybody would do that. So that's what I did. At the time that I started to look at some of these problems that I've been looking at a very high level, I found both Phil, who's our CTO, and Sam, who's one of our advisors, had been building this technology for secure exchange in other industries. I was able to convince them to join us on the journey of fixing US healthcare's data exchange. And we brought Mitch along as well because his network is deep enough to get us into the right areas. So at a very high level, clinical data exchange is when data from one organization has to go to another so that they can provide patient care. Think about a diabetic who's type 1, they go to the clinic on the right, they get care, they have an emergency room visit, so they go to the hospital on the left. Those two organizations need that data to go back and forth in a way that is seamless and secure so that they can provide care. As you go down this web of data exchange, you add in the payers and the providers that are at the clinical level. You talk about the government has to get some of this data, the CDC and everybody else in between. And very quickly you get what's kind of referred to as a web of exchange in the industry. The problem with this is that the data exchange as it exists today is insecure. And the thing I really want to highlight here is, as a patient myself, the fact that 44%, just about half of all of these ransomware attacks actually disrupt patient care matters to me. So when I was getting my care through Huntsman, I was using the only proton therapy machine in the Rocky Mountain West. Meaning, if that machine gets shut down, I can't just go to an Intermountain facility and get the same level of care that I need to save my life. So beyond the patient pains that are experienced when these ransomware attacks, when this insecure data comes to the forefront, it costs millions and millions of dollars. So for example, Ascension just put out report about a month ago that they were posting a $1.1 billion net loss on their revenues. And one of the main reasons they cited for this was a cyber attack that they experienced in May of this year. So it's a problem that isn't going away. And beyond that, these hospitals get caught in a catch-22. So they can either pay the ransom to the tune of millions of dollars, or if they don't pay the ransom, then the bad actors will exploit the data, and then they have to pay class action lawsuits. So Lehigh Valley Network just paid $65 million in a settlement to patients because they didn't pay the ransomware attacks. So hospitals are caught in this rock and a hard place situation. So all of this Googleable information, you can find this online. This is the piece that healthKERI brings in that is ungoogleable tech. So our contention is that at the core of every single one of the major breaches that have happened in healthcare in the last decade, it's really one of two things. Either the bad actors are leveraging what we call shared secrets. So this is username and password, X509 certificates, bearer tokens. There's kind of a litany of tech that falls underneath that banner, or they're exploiting trust in third parties. So they are doing DNS hijacks or other similar attacks to fraudulently present themselves as a third party when they are not that organization. healthKERI's technology solves both of these problems. So we create phish-proof data exchange by using a technology that is called KERI, the Key Event Receipt Infrastructure. And we don't have time today to dive into the black magic that is KERI, but it's a new protocol for securing data by securing the endpoints. So you move to phish-proof identities that then transfer data using signed data. And when I say signatures, I don't mean DocuSign, I mean cryptographic signatures. And this allows you to go from point A to point B in a zero trust manner. This is actually live. We built this with our first customer, which is Health Sciences, South Carolina. They're a health information exchange for the state, so they handle all of the clinical data exchange that happens in that state on the back end. We can talk about the architecture later. Basically, what we've built with them is an automated internet scale way to sign and verify every scrap of data that goes through their pipes in a way that then they have what we call zero trust data exchange. The result is that you have something that's highly secure, portable, meaning I don't care what type of data is flowing through the pipes. It could be FHIR, it could be HL7v2, which are healthcare data standards, and then it's lightweight. So healthcare, you know, in the story Dune, the spice must flow. In healthcare, the data must flow. We don't have the luxury of shutting down the system because clinical data exchange is patient care in 2024. So our solution allows you to go flow by flow to secure those pipes in a way that allows you to control the attack surface that is available to bad actors. And that's what HSSC in South Carolina has building with us. As far as how we go to market, we'll readily acknowledge that the biggest hurdle that we have to capture here is that when we're building an exchange solution, we have to get both sides of the exchange to play ball. There's two ways that we handle this. The first is that we target the influencers. So these are health systems, HIEs, other groups that basically say, hey, I'm the big dog when it comes to exchanging data, and I'm going to dictate how we do these things. Then we monetize off of that group and provide a very lightweight signing and verifying solution for the other endpoint. This is exactly what we did with HSSC and Iguana, which is the interface engine that they're using. The other piece, and I'm just going to fly by this very quickly, is that we readily acknowledge that there is a bottom-up, so we capture customers one-on-one, and then there's a top-down approach as well. So Direct Trust sets standards for how tech is used in healthcare to do trusted exchange. They have given us the blessing to start a cybersecurity working group to tackle how some of these technologies we're bringing into the industry will be used. So on the bottom up, we're going after customers. On the top down, we're making sure that we're in the pole position to shape how this technology gets used. Very high level, these are the 4 groups that we're targeting. This is because this is where my network is. If I don't have a first level connection to somebody I need to talk to in these 4 groups, then Mitch does on our team. And if Mitch doesn't, we know someone who does. So there's not anybody in the industry I can't get to for an intro. Very high level, there's a lot here. Happy to share the deck with you. Suffice it to say, there are imperfect solutions to this problem, and we feel like we've solved a lot of those issues. As far as our revenue model, we do a SaaS model where we predict data flows and then we charge that monthly. Right now, we're in the middle of a $1.25 million raise. We've got about half of this committed, $600K. This will give us, as far as a breakdown on how those numbers are spent, you can see that here, pretty typical for what you'd see for a startup of our size. So I'll stop there and open it to questions.
Awesome. Thanks, Jared.
I can't see the chat when I'm sharing screens, so.
Okay, I can read it. Or Suzanne, do you want to come off mute and hit your question?
I said I really like the idea. I think it looks like it's better than a different encryption system, and we don't have time to go into that. Sorry about that. But I want to know if you've investigated HIMSS so that you can get to the CIOs in healthcare.
Yeah, so I've been going to the HIMSS conference for about 10 years now. Really well connected with the groups there. Part of the reason we brought Mitch on is because, just to give you some context, he's the president of the American College of Health Data Management. So between his connections into HIMSS and then his connections just as the kind of president of that network, we have access to pretty much every major CIO that we'd want to talk to. In fact, we were just on a call with Mickey Tripathi this last week, and he's the head of the ONC. So
great. Just wanted to check.
Jared, a question I put in is, you mentioned this South Carolina engagement. What are you hoping to learn, and how is that going to propel you into the subsequent customer engagements?
Yeah, so there's 2 pieces here. Again, because they're an HIE, they have a high level of influence in that state on how they want to exchange data. And in the state of South Carolina, we're talking about hundreds of organizations. So clinics, hospitals, payers, and all of those need to get the data back and forth. And often they rely on that HIE as kind of that primary source to get patient matched data in and out. What we're hoping to do and what we did with our proof of concept was nobody's going to let us touch their PHI until we've proven that this thing is secure, right? That's the primary contention that we're making. So we actually stripped all of the security of the proof of concept off. So we didn't do TLS, we didn't do HTTPS, we just did KERI-based security. And then we had a third party of pen testers come in and shoot at this thing. They couldn't get through it. And this was 2 weeks ago that they signed off. So our next step now is we're moving into a live fire drill, I guess you could say. So we're moving to real data flowing through a pipe to show that we can do that, because we did synthetic data before. Once that's done, we'll start implementing this across all of the data flows that HSSC controls. So probably upwards of 500.
Very cool. Awesome. Thanks, Jared, very much for pitching, and look forward to your success. So don't.
I just had a quick question. Sorry, this is
Go
Atul
ahead.
here. I was just wondering, Jared, thanks for that. I think it looks very interesting. How does, if healthKERI plan to integrate with the existing identity management system, and what incentives are in place for like third-party adoptions and such?
Yeah, so I guess it depends. What do you mean by existing identity management systems? Because there's a lot in that moniker.
Yeah, so most of the B2B side of things would have their own identity management systems in place, the traditional way that they handle their identities and security and trust in general, right? But as I understand, healthKERI is more targeted towards decentralized solution.
Yeah, so the core of what KERI does is decentralized, but really what we're hoping to do here is upset the apple cart of the certificate authorities. So right now you go get your SSL certs, etc. And when I talk to the executive leadership at those organizations, I find that to an extent they're asleep at the wheel. The certificate process has been unchanged for about 20 years. They assume that because no one's actively complaining to them, that the solution is sufficient. When I talk to their customers, it's one of the biggest pain points that they have. They do not like doing certificate management as it is now. And what we're offering is a way to get away from VPNs, APIs, and all the cert headache and do it in a way that's automated. So the other thing to note here is there's also a major security gain over the current system. So right now, NIST says you're supposed to rotate your keys monthly. Most people do it every 3 months or every 6 months. In our proof of concept, we were rotating keys every hour. And there was no drain on the system to get that done.
Okay,
Thanks,
thank
Jared.
you.
Thanks, everyone. We got to move on to the next one, but we'll open up some space after our next pitch where we can do some additional Q&A. Before we have Dallas jump in, Taylor's going to take a minute and plug 2 opportunities from Summit.
Thanks. So in line with what Chris was talking about previously, where we're looking to engage with all of you or people like you, we're looking for co-founders or potential co-founders in a couple of our projects that we're doing due diligence on right now. One is called Carrot, and it's a new tool out of University of Miami that basically streamlines the clinical trial feasibility that a researcher wants to do. So if a researcher wants to create or do a clinical trial, this software identifies how difficult the process would be to recruit or patients or otherwise, multiple steps in that process. This helps identify those clinical trials that have a higher likelihood of being approved by the governing boards. So that one's called Carrot, and that's one we're looking to commercialize or at least test through our market validation bootcamp. The other one is called TRRP. That's short for Trauma, Resilience, and Recovery Program. Basically, 37 million patients have ER visits annually, and more than 20 to 40% of those patients that have traumatic ER visits develop PTSD or depression. And so this program helps the providers follow up and keep track of those trauma patients and address the treatment of the PTSD and depression. It is becoming a best practice to do this, but the follow-up is really difficult for these ER programs. So this TRRP manages that process and allows for additional billing for the ER or the providers to book based on the activities that the program provides. So 2 opportunities that we're looking for entrepreneurial leads on to take through our market validation bootcamp.
Thanks,
Thanks,
Taylor.
Victor.
Yeah, and thanks, Chrisman, for following up in the chat with some of these opportunities. All right, we'll have our concluding presenter, Dallas, with RaiseBerry.
All right, guys, it's for real this time. I got it
Prove
ready.
it.
Hey, let me get in here. I will share my screen right now. All right, ladies and gentlemen, we are a solution to kind of an age-old problem, guys. We've had, there have been there's a lot of, I guess, competition in this field. It just really, we're not here to like completely disrupt. We're not here to reinvent the wheel. We're just here to make things that people are already doing and are forced to do every single day, every single year, a lot easier. So we're a fundraising platform. We serve things like high school teams, 501c3, charity foundations. We serve universities, larger enterprise youth groups. Think Pop Warner is one of our contracts right now, Boys and Girls Club of America, things like that. We, oh shoot, that went too far. We do that in a simple way. Okay, guys. Basically, there's 2 types of fundraisers with most of these groups. One, product fundraisers, and one is just straight donation fundraisers. And that includes events and things like that. The thing is, product fundraisers work the best. They are just the hardest. They're the worst. Donation fundraisers are effective as well. There's a lot of infrastructure that's not there, that people have to go and find, like have 3 parents with Venmos at a table processing payments, doing things like that, and then bringing it all into one, the shared account for whatever program we're talking about here. With us, we have made product fundraisers as easy as donation fundraisers. And another really important thing that kind of separates us from other people within the industry is our ability to start where people are familiar, right? If you're already running events, we just make that easier. If you're already running product fundraisers, we make that way easier. And then being able to go in and expand what they're able to do from there is a way that we've been able to reduce churn in comparison to other companies providing solutions in the industry. We're located here in Lehigh. We just had to update the headcount thing. We were 5 a couple weeks ago. We're at 10 now. We're hiring 5 more people next week, and 2 weeks from then we'll hire 5 more. We've nailed product market fit. So it took us a while. The problem itself I came across while working for another company here in Utah called Viddy. They're a live action camera company. I had a thing where I actually went through and sold all of their cameras. So they wanted me to go and find other channels. I went to a school district board of education president, was kind of like, hey, this is what we have. We'd like to sell our cameras through you, and created a simple fundraiser. It was just an email link that people could send out, and people bought a live action camera. A portion of those proceeds went back to the education board. At the end of the fundraiser, I was like, hey, what if this was a thing? What if we could create something that gave you guys the ability to just have an online fundraiser where you didn't have to go door to door if you didn't want to, or just gave you access to something like this? I went back to the CEO of that company, and he was kind enough to be like, hey man, this is a whole company you just figured out, basically. Board of Education president couldn't find anyone who does basically that. Just create a landing page. where people can go and participate in a fundraiser. So from there, we kind of built the product out. I married a lady who is a color guard instructor. She's with American Fork Color Guard, with kind of the help of band directors around the state, the help of other organizational directors for Pop Warner and things like that. We're able to create software around actually solving the problem. And again, not in reinventing the wheel, just making the things that they're already doing a lot easier. And yeah, for us, being able to do that came in stages. We went to the conventions, we did all that stuff, and we figured out that the SDR model actually works really well with what this is. And there's a few reasons for that. It is hack and slash, but we found something that works. But first, before I go into that, I'd like to we're just here to help organizations, right? Our clients are the same that I listed: schools, youth associations, teams, and nonprofits. They like us because it makes their life easier and it's free. So there's less barriers to entry as far as coming in and getting a campaign up and going. We are able to grow in a few ways, but our main thing that we've really hit a home run with, like I said, is literally cold calling. We know exactly where people are. We know when they're there. We are doing a $5 million raise right now. We have done that mostly out of state. So you guys are the first people in Utah that we've actually pitched this product to. And yeah, we make sense for a few reasons. A lot of people have been talking about the top down, the bottom up method. We make sense to teachers, youth group leaders, coaches, people like that, for the reasons that I said. It makes their life easier. It gives them one organized place to do this. We also give them the ability to run more than one fundraiser type on one platform. We make sense to large youth organizations for all of the reasons we make sense to coaches and teachers, right? Large organizations aren't going to accept us unless we actually make their underlings' life easier. But one thing that really is great for large organizations is they can transparently see everything that's happening under them. Any organization at any level under them, think Pop Warner, is able to then see what their regions are doing. Their regions are able to see what their individual teams are doing, and those teams are able to see what each kid is doing going out. They also are able to funnel some of those proceeds up to them, an insignificant amount to the program itself, but to the overall organization, it means a lot, right? Having a source of revenue that's free, that's plug and play, that can make, I mean, Pop Warner anywhere between $80,000 and $150,000 for a 501c3 is really, it's cool. It's an easy pitch for them. The basic way it works, guys, we have products that we provide, RaiseBerry. People can pick products if they're doing a product fundraiser. They can also just create their event, right? The gala, the car wash, the trunk or treat event, the carnival. They can do that. If they are using a RaiseBerry product, they never have to touch products. They don't have to buy products up front and manage inventory. They never have to manage payments. So they don't have to send kids out, have them disseminate products, come back with cash, count that cash, and figure out how much they make. All of that is automatic. And with us, they're never going to get a bill. Okay, so they're never going to do something that ends up costing them money. Everything is free to them. They can share their landing page. We ship the products ourselves, so we don't ship the product to them and then have them ship it out. We ship the product to the consumer or the supporter themselves. We have a lot of products, and this is something that we're actually getting better at, and we've got better at over the last couple months. And really, there are places that we're improving, but these products are a really big. When you think about product-led growth, this is something that really gets people to understand the product end, right? They see like, oh, I understand that RaiseBerry helps makes XYZ easier, and I actually see something that I would be willing to represent or sell. Kids can go door to door with it. But the main thing is you just get a link and a landing page. You can share it in every way that people do that right now. Social media, text message, email. We give them tools, templates, and things like that to assist with that. You can keep track of what everyone's doing.
Thanks, Dallas. If you've got an ask slide that you want to have up while we go through the Q&A, that would be awesome.
No, totally. We're not really, as far as asking, we're just at the beginning of a raise. We really have just been doing RevOps here over the last year. So any input, really the thing that we're looking for now is to improve our UX UI and just our product conversion. So product-led growth, getting people into the website and actually converting that way. Because cold calling people, when we get people on the phone, we have over a 60% conversion rate right now. So Hack and Slash is totally working. Really,
Let's open up some space for some Q&A then. If you've got questions, come off mute.
Dallas, can you talk about the competition that you're facing in this space?
Yeah, so it's actually, there are a lot of people doing this. Think like you guys have had kids that run fundraisers, right? Think World's Finest Chocolates, things like that. The thing that really separates us from them, just two really simple things. We meet the supporter where they're at. Because we're not a product company trying to shove a product down someone's throat, we basically, the way that looks is you can either buy the product, the vanilla, the whatever, if you want it, if it's a product that makes sense to you, or you can just go ahead and donate. We make money off both. Okay, we get a product margin from products. We get a margin from transaction fees. It gives people the ability to be like, you know what, I don't want that thing, but I do want to support you. It also gives people the ability to get more people involved than in their immediate area. The other thing with us is really we're able to, because we built versatility into how people are able to run fundraisers, that's the main reason we are able to cold call people and actually be effective. We can start with what they're doing now and then branch out from that. And yeah, competition, people have to run fundraisers. It's like their least favorite part of every year. A band director signed up to be a band director. And us making that easier and then giving them the ability to come back and run multiple fundraisers throughout the year, get assistance with that, has been a big difference as far as us and the competition. Traditionally, they pick 3 different companies, run fundraisers with them. With us, they can run basically everything they're trying to do all in one shot.
Dallas, Annalise asked a question about, do you imagine kids bringing home a link, teachers? How does the word spread? What's the kind of the path?
They do. Yeah. So there are some, there's 2 different types of fundraisers when it comes to participant and non-participant, right? So when you think participant, those are students. You've got a band, you've got a football team, you've got whatever. Each kid gets their own individual link. They share it on their social media. They can also walk door to door and show their QR code. Any purchases made go toward them. So kids do disseminate it. But also think of like 501(c)s. So like Wounded Warrior, I'm a veteran, so we're in with a few of those. Wounded Warrior, Adoption Agency, Children's Hope for America, things like that. We've ran fundraisers and they just share a general link to all of their followers, right? They don't have little participants. It's not like the kids trying to get adopted or raising money. They are just blasting it out. So yes, they're participant fundraisers per participant are way more effective than per follower fundraisers, but both make RaiseBerry money for sure. Yeah.
Awesome. I think we've got time for one more question if anyone wants to come off mute.
I'm a little curious, David, about fundraising for nonprofits. Could you share a little more about that?
Yes, yeah. So we fundraise for a lot of 501(c)s. It basically, the biggest thing with 501(c)s is what's called donor fatigue, right? So you can go out to everyone and say, hey, we're raising money. It's that time of year to do it. Readdressing them again in the same year or even the same quarter can be tough. Creating versatility, or can create just washout, right? They call it fatigue. Being able to create versatility, maybe doing one event, one donation drive, and one product drive. As long as that product drive makes sense, right? With Wounded Warrior doing things that make sense to veterans or people supporting veterans, you can imagine those items are different than the things that we do for an adoption agency. Flowers for Mother's Day, gifts for Christmas, things that make sense. 501(c)s love the idea of being able to address people in a no fuss way, with versatility, right? In kind of more than one way. But yeah, 501(c)s are definitely something. It's a huge portion of our revenue stream for sure.
Awesome. Thanks, Dallas.
Yeah, no problem.
Thanks everyone for coming out today. Hope this was beneficial. I know it was for us to be able to present a little bit about Summit Venture Studio as well. We'll be here next Tuesday at 11 Mountain. Check LinkedIn for speaker details and networking, and we'll see you then.
Awesome. Thank you.
Thanks all.
Thanks.
Bye-bye.